Good afternoon. My name is Nancy Eaton. I'm the Nursing Simulation Lab Coordinator here at Temple College. We want to welcome you all from Baylor Medical School to join us next Tuesday, October 14th, for our Fall 2025 Interprofessional Education Scenario. So I'm just getting started with a really fun picture. I'm from Galveston. If any of y'all have ever lived down in that area, you know what the beautiful sunrises are on the beach. And this just brings me to my happy place and kind of grounds me when I are having a tough day, trying to get ready for something big like this, like the IPE. And so it's just a fun picture just to look at and kind of take some deep breaths. So for everyone to be on the same page, it's important that we understand what interprofessional education, or IPE, stands for. You can read different definitions, but they all basically come back to it's a learning approach where students from two or more disciplines, or healthcare disciplines, but it could be other disciplines as well, but we're talking about ourselves right now, that learn together to enhance collaboration and improve patient outcomes. Core principles, very important to know. It is to learn about, learn from, and learn with each other. We cannot work in a silo as healthcare workers these days, especially today in our society. So we need to work with each other and learn from each other as well. Work as a team. Again, I just mentioned we cannot work as a silo by ourselves in any situation in healthcare today. It takes everyone to take care of our patients. And then to focus on our patient. Patient-centered focus is very, very important. Our patient for this scenario is Helen McCloskey, and I'll be talking a little bit about her history and such here in a little bit. But just to take this definition of IPE a little further, know that by learning this way, or being in these type of learning scenarios, will improve our patient outcomes overall. The more we work together and learn from each other, the better our patient outcomes will be. We hope to reduce medical errors or medication errors, increase patient and family satisfaction, huge. In turn, by reducing errors, improving outcomes, we're going to also reduce cost, which is huge. And then, of course, enhance our own satisfaction within our profession. I have worked with many professions or disciplines over the years of my career as a nurse, and I can tell you I've learned a lot. I hope I taught a lot to others and was there for them when they needed me as a nurse. Our learning objectives. You can see the top two have to do with communication. Communication among members of the healthcare team and also with our patient and family. We need to perform an appropriate patient assessment. I say the patient assessment is the foundation of who we are as healthcare workers, and we need to make sure it's right, it's done well. Because if we don't, the next objective is to initiate appropriate interventions. We can't do that without knowing what's really going on with our patient. So take those moments, those few moments, anytime you walk in a room, to look around, to look at your patient. What is happening? Don't keep our heads between our legs. But back to communication. Without this, that's where medical errors and poor patient outcomes can occur. And so we need to be very diligent to communicate clearly and so forth. And I'm going to talk a little bit about that, more about that here in just a minute. Sorry, went backwards. So the 7 C's of communication. Coherence. Don't mumble. Don't talk down. Don't put your head between your knees and talk. Talk straight to the patient. Call them by name. Okay, and we'll have name tags for you and the rest of the healthcare disciplines that will be working during this simulation that day. So look at their name tag and call them by name. One that shows respect, and courtesy is one of those things down on this circle that you'll see. Concreteness. Be specific, okay? Be correct. Courteous. Be respectful and kind. We're all here learning. We're all nervous. We all have something else to do today that we want to get done, right? So take the time. This is our time to all learn together. And so be respectful to each other. We all have a role to play. Be clear. Again, back to that coherent. Don't mumble. Don't talk under your breath. Don't whisper. Speak up. Speak with confidence. When you're given a blood pressure, don't say, well, I think it was 180 over 90. Say blood pressure, 180 over 90. We don't need a lot of humming and hawing through a simulation or through any crisis in healthcare, do we? And then be concise. Very, very important. You don't need to necessarily tell a story. That's why we have the SBAR in place to tell those give that information that we need for each of those bullet points and to be concise and to the point so we can move on and care for our patients. Closed loop communication. These are 2 little videos that you can watch. They're very, very short, less than 5 minutes each, or altogether, I believe, that you can view a poor closed loop or poor communication and the proper way to do closed loop communication. And again, it's calling the person by name, repeating what the order is, letting that person know that they were correct when they said that they repeated the order, okay? Making sure everybody is on the same page. Again, it's not the patient in 118. It's Mr. Smith, Alan Smith in 118. So we know which patient you are referring to. So if you gave me a healthcare order prescription for Mr. Alan Smith in 118, I'm going to repeat back to you. For Mr. Allen in 118, you would like me to give a stat dose of furosemide 20 milligrams IV push. Whatever that order is, I'm going to repeat it back to you. Now with Epic today and some of our other advanced electronic healthcare records, we've kind of gotten away from verbal orders or read back orders, and because they're in the chart, they're easily put in. But in this scenario that you're going to be going through, we're going to be you're going to be giving verbal orders and prescriptions. So it's very important that the one you're giving it to, you call them by name, you tell them who it's for, you tell them what it is, so they can repeat it back to you and make sure it's correct. So again, these are very short little videos, but this is so important during this type of simulation. So the first 2 bullet points on here, review pages, excuse me, reviewing the patient chart. Y'all don't have access to our EHR systems here. I apologize, but I will tell you a little bit about Helen McCloskey. She is a 93-year-old lady that lives at Shady Oaks Long-Term Care. She has been there a couple of years. She is a widow. She only has a sister living. She does have a history of some heart failure and joint disease, and her family history is cardiovascular disease. But she woke up this morning, tootling around her room. She went to the restroom, was coming back, and started feeling short of breath and a little bit of chest pain. This patient at this stage in this scenario is a standardized patient. You will not be involved at this point, but just to kind of let you know the history of how this evolves. From there, the nurse at the LTC will evaluate or assess, identify what interventions may or may not need to be initiated. From there, they will also call EMS. EMS will arrive and do their assessment and follow their protocols as needed based on their assessment, and then transport her to the emergency department with a radio call, letting them know what's going on and who the patient is and what's been happening, okay? At the ED is where you kind of step in as soon as the EMS folks transfer the patient, give their SBAR to the ED staff, then you will be summoned to come into the room and get that report from the nurses, okay, and proceed with whatever treatment plan or interventions that you deem necessary based on the patient's assessment. We will have, at that point, the patient turns into a mannequin, and anything that's done as far as interventions will be done on the mannequin. We will have RNs in the room, RN students, but they will be representing an RN. We will have a med nurse, a recorder. We will have respiratory. Our RT team, our program is not able to be involved this time. So we will have some of the nurses, some of the vocational nursing students be a part of, play that role. Though they are not respiratory therapists, nurses can apply oxygen if they are given an order. They cannot intubate. So one thing I stress, and I'll talk about healthcare roles here in a few minutes, but our nurses and our nursing students, of course, have to work within their scope of practice at all times. They cannot give oxygen unless they have protocols or orders. Okay, they cannot give a medication unless they have an order. And so if you want oxygen applied, you will have to say, please apply oxygen, blah, 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 okay? They can put on face masks, they can put on non-rebreathers, they can put on nasal cannulas, they can ambu, they can bag and mask, okay, if needed, all right? They just cannot intubate. So if that's something you feel is necessary during this scenario, then you would have to initiate that, and they can assist you, okay? Always tell our students, review your CPR skills. It is very important that you do those correctly anytime that you're practicing or actually, of course, doing them. So one of the things that Elizabeth sent you guys was the different healthcare roles, the standardized patient role, family member. We have the long-term care ADN student. We have the primary nurse, the secondary nurse, the med nurse, the recorder, and so forth. Review those. As mentioned just a second ago about our scope of practice, our scope of practice is different than yours. And so we really stress and work hard with our students to understand what their scope of practice is, because so many times in the real world, things are are made very blurry. And we want for them to understand the legal ramifications if they do work outside their scope. And so we really stress it here. The link to the overview of a code is just a very simplistic video, very short, maybe about 5 minutes long, of the different roles and how they play into a scenario such as this. The video on the end, the LTC video, basically was for our students, but you're more than welcome to look at it if you want to, of what that role of the RN in the long-term care plays. And it was just a guide for our students because many of them have not been in long-term care yet. So details, look at your schedule. I believe Elizabeth has told you when to be here. And so be here. We will have the most updated schedule when you get here. And so just be aware your schedule shouldn't change, but be here on time, please. That is very, very important. The standardized patient, I already mentioned, we're going to have a standardized patient. We're going to have a family member. We're also going to have a chaplain, which is a new addition to our simulation, but we feel like this is going to be a great addition to this scenario and for the team itself. You will be put in a group when you get here. Each group will have a folder of different items, the schedule, the student roles, a code sheet, an assessment sheet, an SBAR, and so forth. Anything that you probably need during the simulation will be in your folder. I will also ask you to sign a confidentiality form. We take this very serious, not just in the real life world, but during our simulations. The things are not shared in between groups. We don't share with other team members or members of other teams because there's a lot of reasons. One, we need to get in the habit of upholding confidentiality throughout our careers, and that is very important. The other thing is, and I'll say this on Tuesday, if you've ever had your private information stolen, and I'm not talking about bank information, that's bad enough, that's terrible, but your healthcare information, and I have nothing to hide, okay? I've always told students, I have nothing to hide, but you know what? It still feels very wrong when it happens. And then we also have a survey at the end, and this comes after the group debrief, and we'll go over more of that, but it's also on the schedule that Elizabeth had, and that you can look at. But there'll be a small group debrief, and then a debrief with your facilitator for that simulation. And then after everything's done, an IPE survey. And then when you're completely done, whatever your staff and faculty have told you can do as far as leaving or staying, that's between you and them, okay? These are some other videos of our health science building. Again, most of this is probably like, I know how to use a monitor. I know how to use a regulator or a flow meter. Yeah, sure, you probably very much do, and that's awesome. The HSC orientation kind of shows you the room and the mannequin and such. And so if you've never been over there, it's nice just to kind of see what the room looks like beforehand. So it's not a total, what is this? What is this place? It is set up a little different than an ER, but it's similar. And then this is another simulated code with real people, not just cartoon figures. And it actually is a very controlled simulated code, but we show this to our students so they can practice recording. That's not something they're used to doing, and so we try to get them in the practice of this beforehand. But again, it's a good video to watch. If you've not been in very many codes, it's a good video to watch to see how a code in a perfect world might work. And so that is for your use as well. So again, we welcome you guys. We're excited about this. We've been working with your staff and faculty since March, I believe, on trying to get this set up, and we look so much forward to working with y'all and making this a great learning opportunity. See you Tuesday.